All right, folks, welcome to the call. I'm really excited to introduce Dr. Veena Vats. She's the CEO and founder of Trinity ENT in Gilbert, Arizona. Dr. Vats has owned and worked for Trinity for about 20 years. And if you guys want to ask her a question, it goes privately and anonymously to her. Just hover your mouse over the bottom of your screen, type your question, and Dr. Vats will be able to answer it. So Dr. Vats, we're really excited about you. Thank you for your time and welcome to the call.
Well, thank you for having me, and thank you everyone for spending a little bit of time with me today. Let's talk about why we're all here today, and that is to talk about obstructive sleep apnea and how common it really is in America. It affects so many people. It's caused by the relaxation here of the tongue and the soft palate. It falls back when you fall asleep, and it just blocks you from breathing at night. When we look at sleep apnea and we try to measure it, we're looking for is how low your oxygen drops at nighttime, how many times you actually stop breathing at nighttime. And on the graph down there, you can see that based on the blood oxygen level, you can see how it dips down to 84% and then it drops down to 74%. You really want to try to keep your oxygen in the 90% at nighttime. So here's an example of someone who's got a couple of apneic episodes. And over time, at nighttime, boy, that can be really detrimental, and we'll talk about that in a minute. So with those repeated pauses and breathing at nighttime, or drops in saturation, oxygen saturation at nighttime, that's really translating to, honestly, less oxygen being delivered to your brain. So when you wake up in the morning, you're tired. It can be a community safety risk. We've heard about people falling asleep at the wheel because they just didn't get a good night's sleep. Your body doesn't like it either, not getting good sleep. We know that it can cause strokes and it can cause heart arrhythmias, including atrial fibrillation. And finally, all the noise that you're making, tell you what, your bed partner doesn't want to hear it. And all too often I hear about bed partners just leaving the room and going into another room. I think that's a problem. So first line therapy for sleep apnea is actually to use a CPAP machine. If you use it regularly, hey, it's great. I'll tell you what, if a CPAP machine works for you, if you have sleep apnea, stick with it. But in my practice, I do see a lot of patients that just can't tolerate that CPAP. So options to treat your sleep apnea, besides using a sleep device, are here. One of them is an oral appliance, typically fashioned for you by a dentist that specializes in making these kind of devices. Basically, it's a mouth tray that fits on your upper and lower teeth, and it literally just juts your jaw forward, kind of pushes your jaw forward like that. And as your jaw gets pushed forward at nighttime, that will push your tongue forward. So if you can recall from the first cartoon show slide that you saw, if we can get your tongue out of the way when you sleep, then okay, maybe you'll sleep better and not have so much obstruction from your sleep apnea. So that's an option. This oral appliance is an option for treating sleep apnea. Probably it works best in people with mild sleep apnea. There are other types of surgeries that have been done in the past for sleep apnea. Everyone has heard about taking off the uvula, that thing that hangs on the back of your throat, or taking out your tonsils. And I'll tell you what, that has been largely abandoned. When I was doing my training days 20 years ago, that was what we did. But I'll tell you what, that is 20-year-old technology and we don't do it anymore. So enter the Inspire. This is a fantastic device. I'm really loving it for my patients. It's an outpatient procedure. It's safe. You can see an example of the battery pack that looks exactly like a battery that you might see for a pacemaker or a defibrillator that your friends may have. And here's an example of how to use it. So he pressed the button on it. He's taken some breaths. There's a sensor that senses the rib cage expanding, which sends a signal to the battery and ultimately to the nerve that's outlined in yellow. And you can see how the tongue gets activated and gets pushed out of the way. And thereby you can breathe and get air in through your nose and mouth a lot better. That's as simple as that. This is Inspire at its finest. So,
Dr. Vats, that video showed 3 incisions, and you were one of the first to do 2 incisions. Talk about the new approach.
Yes, that's another exciting thing that we're doing with Inspire now. On the cartoon here, you can see that there's a sensor that's located kind of lower in the chest. Indeed, that sensor is no longer there. Instead, we're doing this 2 incision approach where you get 1 incision underneath your jaw on the right-hand side of your neck, and then another incision just above your nipple area, perhaps your upper chest area, and that's it. You only get 2 incisions. It's a fairly quick recovery because it is only 2 incisions. Outpatient surgery, I tell patients if you want to take some pain pills for a couple of days, it's probably all you need. And indeed, that's been my experience. The battery itself lasts for about 11 years, which is way longer than perhaps a pacemaker battery might last for only 2. And these are all MRI compatible. So if you ever had to get an MRI, don't worry about it. You can still get an MRI. This is a nice video that shows on the left-hand side of your screen what anatomy of a person who has sleep apnea. Basically, try to look for that black hole. See how that black hole is pretty tiny there? And that's the back of your tongue as it falls back in a person with sleep apnea and just closes off that black hole. The palate is going to be situated just above the back of your tongue. And then on the right side, this is a person who's getting stimulated with an Inspire. And you can see that black hole is way, way bigger with the stimulation at the back of the tongue and also in the back of the nose. The palate's going to be the back of the nose. So the stimulation really makes that airway wide open. And that's the kind of hole that you want to be breathing through your nose and throat when you're sleeping. So after you have the Inspire implanted, your first time that it actually gets turned on is about 4 weeks later. And that's done to your sleep medicine specialist, your doctor that actually got your sleep study to begin with. The visit usually takes about 20 or 30 minutes. You kind of fine tune the amount of energy you want that battery to be delivering to your tongue muscle. And that's all, it's going to be different for every single person. And that's you working with your sleep doctor over a couple of visits over several weeks. Okay, so how do we figure out who's going to be the best candidate for the Inspire treatment? The indications are listed here. You should have moderate to severe sleep apnea. Now, this designation of moderate to severe sleep apnea that comes right off of your sleep study. And that number, it's a number that we're looking for. It's basically greater than 15. We want to have people for Inspire that are not tolerating the CPAP machine. Obviously, I think that's why you're here. If you can't tolerate the CPAP, okay, that is one of the criteria that we definitely use and document that you're not able to tolerate that. You should not be significantly overweight. And this is another number that we look at. It's called your body mass index, and it should be less than 35. So the person who's extremely overweight, okay, they probably need to lose a little weight, get in a little better shape, and then Inspire is going to be probably a great option for that person. There is an endoscopy procedure that I perform a few weeks before we do the Inspire. That does require an operating room visit. It's a minor procedure, but I have to examine the back of your nose and throat as you're snoring, as you're sleeping. And as long as I can document that, then you are essentially pretty much guaranteed that we can get this approved for you. That's why we're so excited about Inspire, because we really can reach a lot of patients with Inspire. Here's an example of Joanne. Joanne's a sweetheart. She lives out here near us in Arizona. And what you can focus on are the red boxes. And the red words that are written pre-Inspire AHI. AHI is the measure of the degree of sleep apnea that you might have. And hers was moderate at 21 and 0.83. And with her treatments, she was able to drop that down to 1.97. So Inspire dropped her down from 21 down to 1.97. That's a cure. So Inspire cured her. This is another example of a wonderful patient we have down nearby us as well. Randy, this is a nice picture because it just shows how great he looks. He lost plenty of weight. He just has so much more energy. He's active and he's happy. Yay for Randy. Here's my contact information. I'd love to spend some time with you, talk more about it anytime. There's a way that you can enter your telephone number in the Q&A, and we can get in touch with you.
Yeah, folks, so if you have questions for Dr. Vats as you're writing down that number, please ask Dr. Vats. We do have our first question comes in, and it says, I have Medicare. Does Medicare cover Inspire?
Absolutely. Absolutely. Medicare covers Inspire. The weight issue, the weight number should be a BMI of less than 35. And again, with a BMI less than 35, I can really capture a lot of patients, Medicare patients, absolutely too.
Someone else wants to know, and maybe they're not quite what you would call a techie person. They say what is the learning curve? You mentioned there's a sleep remote. What is the learning curve with that?
Right. It's really quite easy. This is it. It kind of looks like your computer mouse that you have at home. This is the on button. I can't see real closely, but there's a plus and minus button on there where you can adjust the settings. So it's as simple as using your home computer mouse. You just place it on your chest and press the button. That's it. Super easy.
All right, folks, if you have any final questions, please ask. We'll be here. One more, Dr. Vats. It says, what does stimulation feel like? Does it wake you up?
No. So when you activate this device, you lay down, you turn on your remote, and then it actually turns on anywhere from 5 to 20 minutes later, and you adjust that. So by the time you've fallen asleep, that's when it turns on. And no, it's such a minimal amount of energy that's being delivered to that nerve that it doesn't wake you up. And all of my patients and all my clients have told me, no, they don't feel it because they're sleeping.
Wonderful, folks. Well, thank you for joining us, Dr. Vats. Just really appreciate your time. Folks, I've known Dr. Vats for over 10 years, and one of my favorite things about her, she's really smart, but she doesn't make you feel dumb. So thank you, Dr. Vats, and we really appreciate you.
Hey, thank you all for your time. Thank you, Ben. All right.